Hi everyone, good evening. Thank you so much for being here today. My name is Emanuela Clicci and I'm really excited to share my iResearch Capstone Project with you all. My topic is AI in medicine and the effect of diagnosing patients and providing treatments. Now before we start, here's a little about me. I'm a rising 10th grader at Gainesville High School. I like science and technology. I want to pursue a career in medicine as an anesthesiologist. Why does this topic matter? I chose this topic because AI is being used widely around the world in both schools, offices, and more. AI is also already being used in hospitals, but I wanted to understand if it's truly improving healthcare systems. I was curious to know if AI is helping doctors treat their patients better, or if it might be risky to people's lives. And I wanted to know if this technology is being used in ways that are both safe, helpful, and fair. My research question is focused on AI's impact in healthcare, especially in diagnosis and treatment. I wanted to know if it's actually improving care for patients and how doctors feel about using it. I also wanted to know if AI tools actually help doctors make more accurate diagnoses and if doctors trust these tools along with how much they rely on them when making important medical decisions for both their patients and themselves. This is the first article that I looked at when I was finding my sources. This first article that I studied explained about the barriers hospitals face when trying to use AI. Even though AI has great potential, it can't be used effectively unless we solve some key problems. This includes addressing technical, ethical, and training challenges, along with concerns about patient privacy and lack of proper training from both doctors and nurses. It's clear that we need rules and strong frameworks so that AI can be used safely and ethically in healthcare. Despite these challenges, AI has the potential to improve outcomes, reduce medical errors, and make care more efficient and faster. The second article I looked at provided me with some insight on both the benefits and risks of using AI in medicine. AI can reduce stress for doctors by doing repetitive tasks like organizing patients' info and recommending treatment options. It also helps personalize treatment by looking at a patient's genetics or history. There are some big risks, like bias in the data, lack of proper oversight, and the danger of relying on the AI too much. Strong and ethical, along with legal guidelines, are needed to ensure that AI is used responsibly. AI should also act as a co-pilot, a guideline for healthcare professionals, and not a replacement. AI can also help close healthcare gaps by bringing services to remote or underserved areas, areas that cannot afford or to go to hospitals. This third article provided some insights in the cost of AI. It takes a lot of money to build AI systems, but the outcome is what makes everything worth it. Doctors can spend less time with each patient by automating parts of diagnosis, which lowers overall costs. For hospitals, this means treating patients more efficiently and accurately. Another key point, AI tools go through strict reviews by the FDA before being used. This ensures that they are safe and work well for patients. Many AI tools are now approved or waiting for approval, showing that AI is becoming an important part of medical practice. These are some real examples of how AI is being used in hospitals and clinics today. In radiology, AI tools can read x-rays and detect things even trained doctors might miss, like breast cancer. In one study, it showed that an AI had detected breast cancer with 96% accuracy. It's also helping in cancer care, heart diseases, and even eye and skin care. In oncology, AI helps identify what kind of cancer a patient has. In cardiology, AI reads heart scans to find early heart problems. In dermatology, an AI can look at the pictures of the skin and can tell if that person is at risk of skin cancer or any type of skin disease. In ophthalmology, AI can find early signs of diseases like the diabetic retinopathy to help prevent blindness. Also, AI could save the US healthcare systems up to 150 billion each year by 2026. And this is because it cuts down on mistakes, speeds up care, and makes sure patients get the right treatment without testing. AI isn't just a theory. It's already transforming patient care in many ways today. I noticed some strong patterns. First, AI is most successful in helping with diagnosis, especially using images like X-ray and scans. It's also very useful in spotting cancers and rare diseases early. Treatment support is growing, but it's much slower because doctors are still cautious about relying on AI for treatment. I noticed some strong patterns. First, AI is most successful in helping in diagnosis, especially using images like X-ray and scans. It's been very useful in spotting cancers and rare diseases early. Treatment support is also growing, but much slower than diagnosis. Doctors are still very cautious about relying on AI. And I agree that human doctors are still very important, especially for decision making, empathy, and communication. A big concern about using AI in healthcare is bias. If AI tools are trained on unfair or limited data, they might make harmful mistakes, which could cause harms to both the patients and the hospital system. One big surprise for me was that learning that AI is used beyond just individual patients. It can help hospitals plan for staffing or track disease outbreaks. I was also surprised to learn that not all doctors trust AI, especially if they weren't involved in developing or testing the tools themselves. AI is essential to know that AI is a tool, not a replacement. Doctors are still much needed in the healthcare systems for judgment, empathy, and communication. Some patients may even prefer doctors to be in the room than an AI. When I first started this research, my main research question was, how has AI affected the diagnosis and treatment of patients in healthcare? From the research, I found that AI has made the biggest difference in diagnosis so far, especially in radiology and cancer care. It's helping doctors catch diseases earlier with more accuracy. AI is also helping to personalize treatments, although doctors are still being careful when it comes to using it for treatment decisions, as it is not fully accurate and is still being developed. There is still a lot of questions to explore. One important question is how AI is actually trained. If the data isn't diverse enough, can it work well for everyone? I would like to study how patients feel when AI is part of their care. Does it make them feel more confident, or do they feel more nervous around it? Do patients trust AI systems or do they not? I also want to hear how healthcare professionals feel about the use of AI. Do they feel supported by the AI tools or do they feel like they're being replaced or pressured? I would love to explore case studies, real life examples where AI has either helped save lives or have made terrible mistakes that have affected the lives of patients. And I would like to see what we can learn from both the works and what it doesn't do. These are the wonderful sources that I use and helped me find more insight in healthcare. Thank you all for being here and listening to my research capstone presentation. Special thanks to my iResearch advisors, the Fraser Medical Library team, and the YOUTHMED program coordinators.